Dr. Matthew Hodes is an honorary clinical senior lecturer in child and adolescent psychiatry and works as a consultant child and adolescent psychiatrist in the NHS in London. Matthew carries out research into mental health of young people in two main areas, which are the sociocultural influences on child and adolescent mental health, and also investigating the interface between physical and mental health. So thank you so much for joining us and taking time out of your Sunday to talk to us today. I will just
Okay, pleasure. Can you hear me all right?
Yeah.
I think you can. Okay, good. Yes, I'm pleased to join you. So I've got the slides here in the little box. Here we are. Okay, can you see the slides?
Yeah.
Okay, great. So thank you for the introduction, and looking forward to talking to you and the discussion. So I'm going to be talking about migration, as you know from the title. And this is very important because we live in an increasingly interconnected world. And this is the first session after your lunch break. So I'm going to introduce you somewhat slowly into some of the tough bits of the data. So this is just an image of the interconnected world. And what I want you to do is to think a bit about, in this interconnected world, what are the big issues of our time? And in fact, what I've done is to summarize these big issues and explain how they relate to migration. So I'd argue that these are the three big issues. First of all, economic inequality and poverty. These are not exactly the same, but actually often poverty does occur because of economic inequality. And that may relate to climate change, which of course is exacerbating poverty in many areas of the world. And economic inequality and climate change actually are factors which contribute to organized violence, conflict, and war. So if we take the Sahara region as an example, increasingly it's thought that the range of conflicts there are driven by climate change and more difficulty in people using the land, and that increasing the flow of people to the north, as well as increasing the risk of conflict and so on. So what we're talking about is an aspect of global mental health. This is a rather different perspective to the one that you've been addressing in the earlier sessions, and I hope you'll adjust to this after your lunch break. What I'm going to be covering, first of all, are a little bit about the definitions and terms, a little bit about the numbers, especially in relation to refugees. And then we're going to go on to talk about the implications of migration, especially for refugees, for mental health and onset of psychopathology. So by psychopathology, I mean both symptoms and psychiatric disorders. So we're going to be looking at data from both these groups, the asylum seekers and those who migrate for economic reasons, for improving their quality of life. Well, when we think about the risks here for mental health, which is our prime concern, we need to deconstruct the terms. We need to think about why do people migrate. We need to think about generational effects, as well as the range of disorders. But also, of course, people themselves are very heterogeneous. And that means, in fact, we need to think about ethnicity. Now, by ethnicity, we mean how people think about themselves in terms of their language, culture and religion, their identity, how they think of themselves as being different to another group. And this changes over time and may change with migration. And we know that culture and ethnicity are related to the particular symptom profiles and maybe risks of psychiatric disorder. However, ethnicity in relation to the kind of areas I'm talking about has not been adequately studied, but nevertheless, it is an important variable. So just something to bear in mind during the talks that we're going to be, during the data we're going to be discussing. Well, why do people migrate? And as I say, this is relevant to understanding the risks that people will be exposed to. Well, of course, many people will flee because of organized violence for what might be called political reasons. And as a result of that violence, there may be death in families, destruction of communities. This is an image from Syria during the war. This is children in a refugee camp, and these are young people lining up to cross the English Channel from Calais a few years ago. Of course, reason for migration for those who are looking for work, and the risks are rather different, although there could be some overlap. So the separation will result in the loss of family and flight from disease and poverty. Nevertheless, there could be ongoing poverty on arrival in the host communities until people have established themselves. But over time, typically the communities become settled, networks are established, and the potential for communication and return to countries of origin is quite usual. So that makes the economic migrants very different to the political migrants, the asylum seekers and refugees, who may have great difficulty or may be impossible for them to return to their countries of origin and have ties with them. So this slide just summarizes some of the key differences on arrival after settlement. And again, this is in fact relevant to onset of psychopathology because of the stress which arises from these experiences. So often asylum seekers are highly mobile in the new country. They may be separated from family. Poverty is very usual. On arrival, asylum seekers are not entitled to work, which then contributes to the poverty that I mentioned. There may be a lot of challenges for the adults in adapting to new culture and language. There may be experience of a high level of racism. Now, for the economic migrants, of course, this group are very variable. Some migrants plan moving because of study or because of business opportunities. And the level of planning, of course, means that the family may migrate together. Poverty is frequent, but not ubiquitous. And the skills, of course, are very heterogeneous in the way I'm describing. So skilled migrants, may have university education, but a lot of unskilled migrants, even within the UK or across Europe, move because of employment opportunities. Some of this is seasonal labor and so on. Some of the risks actually that are experienced by asylum seekers and refugees may also be experienced by economic migrants, such as racism and discrimination. So this contributes to the risks for the economic migrants. Now, in order to understand the asylum seeking process, you have to think about this in terms of stages of legally assigned status. So asylum seekers are those who request international protection and whose claim for refugee status has not yet been determined, and these people are outside their national borders. And refugees are people who have status and entitlement to remain in a country, for example, the UK, for a fixed period of time. So often people have exceptional leave to remain for 5 years, which is a kind of refugee status, which when reviewed after 5 years often results in naturalization. The same process will apply to the children of the asylum seekers and refugees, where they are parents who are seeking asylum. Some have an in-between status, which is discretionary leave to remain. So this is a temporary situation which increases some stress, especially when the status is being reviewed, because many of the countries that the asylum seekers come from are now regarded as safe, when in fact many of the areas are not safe. So how big is the effect of migration for political reasons and fleeing war? Well, if you look at the recent data from United Nations High Commission for Refugees, you can see the vast numbers of displaced people. So this is the most recent data. So there were nearly 80 million people who were displaced. Many of these are displaced internally to their countries. These are people who, in the Middle East, from Palestine, supported by United Nations, and this is the number of recognized refugees. So we've got nearly 20 million people, and a small number of actual asylum seekers and those people whose status is not determined. And you can see, because of recent events in South America, a large number of Venezuelans have left their own country. This map simply shows the distribution of the displaced people, and is similar to the kind of things that you'll be familiar with already from your general reading, but just gives more detail. So the size of the circle relates to the number of people in the region who are displaced. I'm just going to rush through all this because of time, because I know you have a very packed schedule. But just moving on to the number of asylum seekers in Europe, even if there were, if we just take 12 countries in Europe, there were over 100,000 asylum seekers, and these figures on the right are asylum-seeking children. So Germany had the most by 2019, and as you can see, the UK, we had far fewer asylum seekers than many of the other big European countries, but we did have still quite a large number of asylum-seeking children, which is one reason why I'll be giving a little bit of attention to that particular group who are at high risk of psychological distress and psychiatric disorder. Of course, the numbers of asylum seekers changes according to the wars and conflicts, but also, of course, according to national and international policies around how asylum seekers are settled. The policies of the UK and the EU increasingly have been to restrict entry, despite these countries being members of the United Nations, and legally they should be compliant with the UNHCR charters. And this requires recognizing the special needs of children. Well, I've outlined a number of stresses that asylum seekers, refugees will experience. As you can imagine, the high stress events as well as loss will, of course, trigger a high level of symptoms and actual frank disorders. But how high are those rates? Well, this slide summarizes some data from a very recent meta-analysis and review, high-quality study, which has been highly selective in the way in which it selected the studies and using interview-based studies. And these have nearly 800 children. And these studies have been carried out in many countries of the world, but actually mainly Middle East, Europe, and North America. As you can see here, the prevalence of PTSD is extremely high at 22%. So the prevalence of PTSD in settled populations in England would be in children would be way below this, around 2, 3, or 5%. The prevalence of depression amongst the refugee and asylum-seeking children is nearly 14%. The prevalence, the general population of children would be 3 to 5%, and anxiety disorders slightly higher. And as I say, the prevalence of anxiety disorders in the general population of children would be again 3 to 5%. And ADHD, this is around probably double the rate in the general population of young people. So we've got extremely high rates of psychological distress and disorder amongst refugee children. And the rates actually are also very high amongst adults. Because of time, I'm just going to be very selective and focusing on the younger people. Well, how stable are these disorders I'm describing? Of course, the meta-analysis and review that I just mentioned, because it's pooling data from different countries, from different studies, it's a bit like a kind of fruit salad. You don't quite know what is the effect of the disorders over time and how people have changed. So what I'm doing is just going to put up one study to illustrate this, and it shows the stability of PTSD. And I've chosen quite a small study, but a high-quality one, of 46 children who, at primary school age, were exposed to the horrors of the Pol Pot regime in Cambodia. And almost all of them had lost at least one family member. Some of them had lost 2 family members. They were detained in like concentration camps. But by the age of 15, they went to USA, where they were then assessed and supported. And the assessment was with a structured interview, which is a high-quality interview, which is why this study actually is fairly unusual, with follow-up over 12 years, with a relatively low rate of attrition. And as you can see here, amongst this group of young people who had a very high level of war exposure and migration to USA, the levels of post-traumatic stress disorder was fairly stable. So even after 12 years, by which time, of course, these young people have been integrated, they had fluency in English, they were in college or in work, many of them had married. The level of PTSD was very high. It was over 30% even at 12-year follow-up. What was interesting is that the level of depression, the red bar, went down significantly, and by 6 years, most of them were not depressed. And this actually reflects the important but well-known association experienced by asylum seekers and refugees that with integration, with the development of ties and fluency, depression typically reduces substantially. So it is worthwhile for you to remember not so much the numbers themselves, but the fact that PTSD can have quite a high level of stability. The depression with integration and assimilation and employment and so on typically goes down very, very dramatically. This has implications, of course, for who might need treatment. Of course, the groups of people who migrate for political reasons, refugees, are very heterogeneous. And many of the children, in fact, haven't had very high levels of war exposure. So what I'm doing here is just showing up one study from Canada. Again, this is from Canada, Montreal, over 200 adolescents who were mostly not war exposed. So it's the parents who were exposed. Most of these children grew up in Canada, but they may have been born in the countries of origin. And what's interesting about this study is that, and these refugees were compared with the non-refugee controls in the same towns, in the same town in Quebec. So what you had is a high level of over anxious disorder, depression, and conduct disorder. So this group didn't have PTSD, but they had emergence of more anxiety and also conduct problems. And this is interesting because what it reflects is that over time, there are significant difficulties often for the parents in parenting the children, and the families may have had challenges to their organization. Fathers may have been killed or detained. Family function may be impaired. Establishing routines and support for the children may be impaired. And this may reflect the elevated rate of conduct problems and conduct disorder, which may emerge in adolescents in those who are not primarily war exposed. Now, I had mentioned earlier on that the asylum-seeking children, those who flee war zones and travel on their own, are at very high risk. So I just want to spend a little bit of time talking about them. And as you recall, there are around 3,000 of these children in the UK, distributed all over the country, supported by local authorities. So this is a different system as compared to adult refugees or asylum seekers who are supported by the National Asylum Support Service. And for many years, there's been a policy of dispersal, but in fact, many have remained in London and Kent. This is just data from 2011. In fact, it'll be similar now. And in our study, we actually looked at a group of asylum-seeking children from Westminster. This was many years ago, but in fact, I think the findings would be still relevant. And we used a number of different self-report questionnaires. We had quite a small sample, but what we did have was a group of refugees in a similar school to the ones that the asylum-seeking children might have attended. And we showed that, in fact, these asylum-seeking children did have a much higher level of war exposure as compared to the accompanied group. And just how high it is shown in this slide, as I say, using a self-report measure called the Harvard Trauma Questionnaire. So amongst the asylum-seeking children, a quarter had experienced serious injury. About a third had actually been in combat. That means actually being in a situation of war or shooting and violence. Over half had forced separation. This wasn't just a planned, negotiated separation. And 40% had actually seen murder of family members, and about 30% had experienced torture of some kind. So really very high rates of war exposure in these unaccompanied asylum-seeking children. And as you might expect, that is associated with very high levels of psychological distress, in particular post-traumatic stress symptoms. This slide shows what is a proportion in each group that have high risk of post-traumatic stress disorder. So this is decided by the threshold for high risk of disorder, which is a property of the instrument as well as the population being studied. And as you can see here, over 60% of boys and girls were a higher risk of post-traumatic stress disorder, a very high rate, far higher than for the accompanied refugee children. Not only war events that increases psychological distress for asylum-seeking children and, in fact, refugees as a whole. And this study just makes the point that amongst a group of unaccompanied asylum-seeking children in Norway, there was a high level of hassles, including acculturative stress. And this is to do with lack of understanding of cultural issues by the host population, sometimes racism, difficulties in accessing services because of language and so on. Many of these hassles reduce over time, but not all. And these actually are associated with high levels of psychological distress. And the depressive symptoms in this group didn't reduce over time. That's a bit unusual because, as I say, if you follow up asylum seekers, refugees over a longer period of time, depression does tend to get less. And there are different reasons as to why this might have stayed high, to do with the fact that their asylum status is going to be reviewed, difficulties in integration, and so on. Other significant stressors for the asylum-seeking children include being detained in deportation centers, living in unsupported situations, and threats of deportation, as I mentioned. Okay, so what can we conclude for PTSD and related disorders? So we conclude that the higher the level of violence and the greater exposure, the greater the threat, the greater the chance and stability of post-traumatic stress disorder. PTSD and depression have a different course of disorder, and there are many studies looking at this. I've just illustrated this with one. And this different course, in fact, argues for the validity, cross-cultural validity of these disorders. There are many other reasons why we think that PTSD and depression and other disorders can be recognized in people from different cultures, which I don't have time to go into right now, but that might come up in the questions. Ongoing stressors, especially resettlement stressors, may perpetuate depression, even though there is a tendency over time for depression to go down with integration and assimilation. And many of these individuals will have high levels of unmet need, especially at the high levels of PTSD, which can be fairly stable. Now, I've been talking about what in psychiatry is called minor psychiatric morbidity, depression, PTSD, anxiety disorders. But in fact, there are some who have severe problems that could require contact with hospital settings. They may require admission. For example, we studied a group of asylum-seeking children who were carrying out violent self-harm by attempted hanging or jumping from heights. Some children have what we call pervasive refusal syndrome, which is a severe somatoform disorder in which they don't eat, they can't care for themselves, they don't walk, and they become very quiet, very, very severe withdrawal. And this has been reported in a number of different countries and has been related to the hopelessness that arises from the asylum process and applications. And another group who may experience very high stress, which can include PTSD, may experience psychosis, almost certainly triggered because of that high level of stress. And this has been shown in adults as well as adolescents. And this is just one study carried out in Sweden, the largest study actually of refugees in a resettlement country. And the Scandinavians have very good databases, and so they can carry out these studies. And they carried out a cohort study of 1.3 million people. And as you can see, the hazard ratio of 2.9 is much higher than it would be even for the non-refugee migrants into Sweden. So almost 3 times the risk of psychosis in refugees as compared to non-refugee, non-migrant adults in Sweden. That's a high risk. Let's just turn now to economic migration. If you look at many of these studies of migration amongst economic migrants and young people, most of them don't show elevated levels of the kind of minor morbidity that I was discussing, like depression, anxiety disorders, and so on. This is a review which makes this point. There are actually some variations with adults, partly because of the quality of studies. I'll come on to those in a few minutes. But we do know that migration is associated with elevated stress, and that's evidence in young people even. For example, they may have a higher rate of deliberate self-harm and psychotic symptoms. One group of young people who are very much affected by migration are those whose parents migrate for work reasons. And this is a phenomenon that's a very big issue in China. And it's been estimated that over 60 million children are left behind in China because of parents who migrate to the cities for work. And these children are cared for by the remaining parents, or often grandparents. So they have experience of parental loss, but also reduced parenting. And as you can see here, the children are at increased risk of anxiety and depressive symptoms. When I say symptoms, as I indicated, symptoms are identified on self-report questionnaires rather than interviews. So these will have increased risk of these disorders, although what's being measured in fact are increased risk of symptoms. They have high levels of risk behaviors like antisocial behavior and alcohol abuse. And they tend to have poorer educational outcomes. They don't do so well in school with their learning and make such good progress. Let's just move on to look at psychiatric disorder in adults. And I mentioned that earlier on that most of the reviews of children haven't found an impact of migration amongst economic migrants. Of course, that could be because of the way in which they assimilate quicker, they go to school, they learn the language really quickly. But I just want to point out that, in fact, there are quite a number of studies looking at adults that have shown elevated rates of depression in particular. So this is a review of 25 studies showing this. So 15% is a higher prevalence of depression than you'd expect. You'd expect maybe 5 or 8% in the general population would have depression. This is much higher than the general rate you'd expect. And in terms of looking at that rate in terms of a baseline, this single slide summarizes data from a very large study of adults in France, showing that across generations there is an elevated rate of mood disorders. So this goes against the grain of what I was saying earlier, that amongst asylum seekers and refugees, depression tends to go down. What you can see here for the migrants is actually that psychiatric disorder may be higher, and these adult migrants may be higher than for the general population. And this can persist across generations, and this can arise for a whole lot of different reasons to do with family disruption, the living situations they're in, discrimination and diversity, and so on. Now, this slide is rather complicated, so I don't want to spend too long on this, but I just want you to think about the angle of this line, which relates to the prevalence of anxiety and risk of anxiety amongst Mexicans who were plotted here in the horizontal axis in terms of different stages of migration. So if we just take the picture on the left, this is the level of prevalence of anxiety amongst Mexicans who are in Mexico, just across the border from the southern part of USA, who they're compared with. So this is Americans and Mexicans across the same border. So this is Mexicans who had experienced migration across the border. This is Mexicans who are living in USA, first generation, second generation, third generation Mexicans living in USA. And as you can see here, over time, across generations, the level of anxiety went up. So while there might be some processes of assimilation and integration, there are many reasons to think that over time, stress and adversity may continue across generations. And exactly why that happens is not clear. And in fact, it was shown not only for anxiety, but also for antisocial behavior and some other problems that they investigated in the Mexican study. And this slide summarizes some of the reasons as to why that rate of stress and disorder may stay high and increase even over generations. So it could be to do with separation from family, changes in diet and environments. the immigrant parents may be more marginalized from the mainstream. There could be increased conflict between the children and the parents. These effects could be amplified in later generations. The area where some of these effects are most dramatic, in fact, is with psychosis. So my last few slides on disorder is going to be around psychosis. Now, there have been decades of research looking at psychosis in migrants, and it's been shown over that time that migration is associated with elevated risk of psychosis, both bipolar disorder and a non-affective psychosis. And the research has been very thorough, and it's not believed this is simply an artifact of diagnosis, or it's not caused by misdiagnosis. So if we just take one study to illustrate this, which was carried out in Camberwell by Robert Murray and groups at King's. No, sorry, this is a review, sorry. This is a review carried out by people from Netherlands, Canterbury and Sultan, the Dutch investigators. They showed this increased prevalence, increased risk of psychosis, of schizophrenia, across generations from the first to second generation. And the risk amongst the black migrants was much higher even than the risk was amongst white migrants. Okay, so we know that it's something to do with migration as stress, but the black migrants, for a whole range of reasons that I'll come on to, have more stress that may be relating to the elevated risk of disorder. And the next slide, actually, this is the one from South London, sorry, does look at the increased age-specific incidence of psychosis, just looking at the younger group who I'm most interested in this talk, 16 to 19-year-olds. But in fact, some of the differences are similar in the older group, the young adults, people in their 20s. And what you can see here, and you just need to concentrate on the trend, don't worry too much about the line, is that the incidence ratio is much higher for African Caribbean and Black African, but it's still identifiable for those who are in minorities of other kinds, Asian and the other groups. So how do we explain this? Well, Craig Morgan, who has been very involved in looking at migration and psychosis, and colleagues wrote an excellent review that was published about a year and a half ago. Their argument is that the elevated rates of stress shift the distribution of psychotic symptoms amongst the migrant group to the right. As you can see, this dotted line relates to the migrant group, and therefore, in any population, there's going to be a certain proportion of people who have psychotic phenomena. So if you just do a survey of the general population, around 10% of people will have psychotic experiences. But the stress of migration and the challenges of being in a new culture, new language, and so on, increase that proportion from 10% upwards to maybe 15 or 20%. And that increased risk of psychotic symptoms would increase the risk of psychotic disorder. But why that might that occur? Now, this occurs for actually some similar reasons to why the economic migrants may have elevated rates of disorder. But of course, these will just apply to those who are genetically vulnerable. So these processes don't refute or challenge in any way the whole genetic vulnerability hypothesis for psychosis. Amongst the phenomena that have been investigated are the levels of adversities and persecution, socioeconomic adversity, lone parent households, social isolation, and it's been shown, in fact, that high ethnic group contact is associated with lower incidence of psychosis, so suggesting that there's lower stress in this group. And recently, there have been investigations looking at early childhood adversity, abuse, neglect, and bullying, and how that might increase stress, which could be a trigger factor for later psychosis. Well, I just got one slide on services, because given the elevated rates of disorder, we might need to think, or we do need to think about how to reach people and across communities. Attention needs to be paid to referral pathways, to provide appropriate support in terms of languages and information to promote access. GP registration needs to be facilitated, but services need to be organized in a tiered way so those can access primary care easily. And primary care and other services at community level can make appropriate and timely referral to specialist mental health services. And these services are often the ones which will trigger admission to inpatient units. So, of course, the vast majority of migrants, including refugees, are not having treatments. In view of the elevated risks of these problems, there is a need to focus on how they can be helped. And in fact, there are many organizations in the voluntary sector and in the statutory sector, mental health trusts, that do provide specialist services for refugees and displaced people to promote access and provide psychological trauma and psychological therapies and other therapies for distressed refugees or people who have been displaced. Well, I hope you find this an interesting topic, and the question then might be asked, what is it that you could do if you are interested in it? And this slide just highlights some of the areas which you could work in if you wanted to pursue the topic. So firstly, of course, there's from an academic point of view, if you're involved with student projects, BSc dissertations or essays, you can choose to carry out assignments working in the area of refugee or migrant mental health. Later on in your training, when you're doing clinical work or if you're on electives, of course, you can work alongside providers of interventions for migrants and refugee people, or provide support in detention centres. And thirdly, we as health professionals have a role as advocates to try and promote more humane and sympathetic policies for asylum seekers, refugees and migrants. And of course, there are a number of organisations that do this, like Amnesty, Refugee Council, which is an NGO. We can work by disseminating information and lobbying policymakers and so on. Okay, so to conclude, migration gives rise to a range of stressors, but most people are resilient. And even though I focus on the disorders, most people, in fact, don't have disorders, and most will overcome the challenges on their own with contact with their networks. However, there are many obstacles in the way. Migrants, especially asylum seekers and refugees, are increasingly experiencing a hostile environment. And this can increase risk of psychiatric disorders, especially PTSD and depression and anxiety disorders, but also very high arousal can trigger psychotic disorders and other serious problems. Planning services for this group is very difficult because of the change of central government policies, the different flows of refugees. And nevertheless, attempts need to be made at local as well as national level to meet their needs. And policies and laws should be sympathetic to address their needs. Alongside that, those are very high risk, such as asylum-seeking children, require special attention, which is recognised by UNHCR. And this is recognised, in fact, by the local government, local borough responsibilities to provide support for asylum-seeking children who are looked after by the local authorities. Okay, well, this slide just actually illustrates some of the people who have come from refugee backgrounds, just to show the importance of being non-judgmental and open-minded about asylum seekers and refugees, what it is that they can actually contribute to society. And this is a counter to the negative communications and attributions that have often been given to refugees. So Einstein, Karl Popper, a great athlete, and then this is Emma Thompson and her son Tindy, in fact, who was an asylum-seeking child who came from Burundi and was adopted by Emma Thompson. Okay, just because of time, I'm going to move on. So thank you very much, and maybe there's time for questions. What I've done here is to put up on the last slide a number of references, mainly reviews, in case you want to follow up on any of these areas, because I've really have made a kind of very rapid flight overview of this very big topic.
Thank you so much. And as you can see, he's left his email address on the slides if anyone wants to get in contact. We did have a question in the chat. What do you think the impacts of increased pressure that climate change poses to causes of migration with desertification and other kinds of land degradation leading to increased famine, as well as increased pressure from extreme weather events could be?
Yeah, so that was the early slide. Actually, we're pointing out that I think global warming is increasing the difficulty for many people in Sahara and other parts of the world to have sustainable livings, growing crops, and cattle herders are on the fringes of Sahara, and that actually is putting pressure on many of the people there. There may also be pressure in the, I don't know if you know about the issue of the dams in the Horn of Africa, and Ethiopia has built a big dam which could affect the flow of water to Sudan and Egypt. There's a lot of concern around water flows in those countries for people who are totally dependent on the flow of water from the Nile. And there have even been threats of war by Egypt and Sudan against Ethiopia around access to water. Of course, the flow of the Nile is not simply to do with climate change, but it'll certainly be exacerbated by it. And many of the areas of the world which are in low lying could be affected by rising sea levels, which are going to put more pressure on other populations, cause displacement. And actually then what's going to happen, of course, is the distinction I'm making between political refugees and economic refugees might break down, because people might migrate for a whole combination of reasons. And even though, of course, they have to declare they are fleeing organized violence, of course, reality is can be a whole host of reasons why individuals migrate and seek asylum. Okay, are there any other questions? Maybe I can access the question if I go back to the chat.
I think that might have been all the questions we had. Does anyone else have any other questions? I think it's very topical at the moment. There's like so many examples in the world where we need to be kind of talking about these issues and trying to like rectify them and maybe solve them, and to try and help in any way that we can. And I think your research is really imperative in that way. So thank you.
Okay, yes, it's very topical, especially as you say with the Black Lives Matter, and of course the asylum seekers, refugees are one group of people who might come under the kind of remit of Black Lives Matter, but of course, unlike them, many of them don't even have legal status. So in fact, the Windrush generation, the Windrush people who were deported were in fact in legal limbo, and that of course is true for all the asylum seekers. So these people are really at very high risk given their fragility and what I think is the ambivalence of the Home Office to recognise them and support them. So I think lobbying and a lot of other things that we can do as citizens can significantly help attitudes and promote the welfare of displaced people. Okay, well, I hope you enjoy the rest of the conference, and thank you very much. I hope you found this interesting. If you have any questions, I'm happy to answer them. Just send me an email.
Thank you so much for joining us and giving up time on your Sunday.